running the cluster of health tech companies, something like 600 companies in the combined authorities area, I've seen the challenges at every level. Big global companies, great successful homegrown companies, and lots of startups and innovative young companies. And for all of them, the challenges can be slightly different. Innovation as a field has lots of challenges to it. The scale up in particular is really important on the funding side, I would say. And across all of the pitch, collaboration is key to being successful. The thing about innovation is that by its nature, a lot of it's going to produce novel ideas. And that calls for both professional services and other business support services to understand what they're dealing with and how it's different than other things they've dealt with, which is quite challenging. And for the lawyers, it means getting the intellectual property rights properly protected for this idea. It means helping businesses with getting their legal contracts absolutely waterproof. And critically, with a lot of health new developments, it's regulation and being able to meet regulatory standards. And there's a lot of advice that both lawyers and business support advisors need to give in terms of sailing the right side of the regulator. Well, wonderfully, we see great collaboration in the West Midlands, and whilst I can't claim all the credit for that, the cluster organisation is absolutely at the centre of a web of collaborative networks. So the university is absolutely crucial to the R&D input, and I would say quite a lot of spinouts in the West Midlands too. And then in terms of the professional services, they're very keen to be involved if there is a viable cluster of businesses that need their assistance. And they are drawn to clusters, and that's part of the success of clusters around the world, really. And in terms of the businesses themselves and what they want out of collaboration, they're looking for partners who can make things happen for them. Navigators of the system, deal makers, and crucially, especially for that scale up, is finding the right investment funding to support them as they grow. What we find with especially with innovators who are startups, very small organisations, they don't actually understand the regulatory requirements of what they're doing. So it's critical that they get accurate advice right at the beginning so they can set off on the right path towards complying with the regulation. And that's really, really important. And of course, if they're hoping that the NHS in one form or another is going to be a buyer of their services and products later on, part of that regulatory process is also to understand what the procurement processes are for the NHS. And again, good professional service is really important to get that right. Good news on how we promote the West Midlands for its innovation is that we already have a good track record, especially in life sciences and medtech. For example, 2 years ago, we were beneficiaries of 1/3 of a government pot of £100 million to establish an innovation accelerator, and we chose the areas to spend that money on of medtech, health tech and clean tech. And in the 2 years since, we've supported huge numbers of innovators. We've levered in nearly £50 million worth of private sector investment from an outlay of government grant of £14.5 million, which is a pretty good record. And at the same time, the world is taking notice of us. So Thermo Fisher Scientific 2 years ago spent over $2 billion on acquiring our biggest diagnostics and testing company, the Binding Site, and they've made such a success locally of it that they've grown the workforce in 2 years from 500 to 800 workers. So, you know, we've got a good track record to boast about, but it all depends on how we go forward, collaborating, innovating, and attracting that investment.